Hey guys, I'm Dory Cook, and today I will be discussing ACL reconstruction surgery. The ACL is one of four ligaments in your knee. You have the ACL, the MCL, the PCL, and the LCL. The ACL is the anterior cruciate ligament. This ligament is tough, fibrous connective tissue, and it connects the tibia to the femur. This helps when making sudden stops or sudden changes of direction, mainly in sports, but also in everyday life. Um, the main sports where an ACL tear could occur is basketball, soccer, tennis, football, and volleyball. ACL surgery is very common among athletes. Not many athletes may need it. You may just have a sprain, or if it's completely torn, then surgery would be highly recommended, especially if you tear one of your menisci in your knee as well. In those, you have a medial and a lateral meniscus. So when having surgery, you want to be able to be pain-free when you are doing range of motion. You want to have stability and full function of your knee. The different types of surgery, there are four. The allograft and the autograft come from human tissue. So the allograft is cadaver tissue. It is usually a tendon. It is less painful and less invasive. They only make one incision and you have a lower risk of infection. The autograft disease is a piece of your own tissue. It can come from your patellar tendon or your hamstring. They use the patellar tendon because it can grow back pretty quickly on its own, and the hamstring, you have a lot of hamstring tissue that they will be able to use, and it is very stretchy and pliable. With the autograft, there is more post-op pain, and the surgery is longer. The two other surgery types are synthetic and xenograft. The synthetic is artificial, and both of these are in experimental trials. They are not used very often. And the xenograft is non-human. The recovery time for an ACL injury and ACL reconstruction surgery is about 6 to 8 months, and rehab will be needed. This will be done in sports mainly by a physical therapist and athletic training combined, but rehab will be needed to get that full range of motion back and to have less pain after surgery. What to expect within your first 2 weeks after surgery. It will be the most painful time of your recovery process. You will see a lot of resting, icing, and elevation. You will be mainly in bed or, sitting down, and you will not be able to move your knee very much. You will most likely be in a brace that will keep you from bending, flexing your knee, and you will be on crutches. Within this time period, you will need to check on your incision, which your therapist or your trainer will be doing that for you as well. And within these first 2 weeks, rehab will be working on passive range of motion, flexing that knee, but not flexing it too far because we don't want to obstruct the new ligament that has been placed. The third and fourth week after surgery, you will see less pain, less medication will be needed. Your swelling should be going down, and you will start to improve on that knee range of motion. You will start to be weight bearing, but not completely. Your knee brace will be needed, and you will be doing rehab, if not once, multiple times a week. The therapists and the trainers will be focusing on quad and hamstring strengthening because you have lost some of that strength within your leg muscles, and we need to regain those to get that full range of motion within your knee and to prevent any more ACL injuries. 1 month post-op, this will be that month mark all the way until you are completely recovered. So you will continue your rehab with your physical therapist. You will regain that full range of motion if you are consistently going to your therapy sessions. You will gain back your balance, stability, and your strength. These things are very important because without that strength, balance within your hamstrings and your quads, an ACL injury could occur in the future. And athletes who tear their ACL once are most likely to tear it another time within that same knee or the opposite knee in their athletic career. Athletes do require a sport-specific rehab. This can be done mainly with trainers or a team therapist that they see. And this average recovery lasts about 6 months, but it can be longer. So, preventing an ACL tear. A lot of athletes will be working with their strength and conditioning coach, which will hopefully reduce the risk of injury because they are well educated on exercises that athletes need to reduce that risk. But to prevent an ACL tear, you will mainly be doing balance-focused training, plyometrics. You want to make sure that your form is correct in everything that you are doing, jumping, switching directions, and just everyday athletic activities. You want to make sure that you are warming up and stretching before every exercise, every practice, every workout. These things can help reduce the risk of tearing your ACL. It is not completely preventable. You can improve your technique and form to help reduce that risk, but like in football, of course, you're going to see where people are getting hit, ran into, where that knee, that body position can be altered to where your ACL will tear. And of course, that is out of your control. A lot of ACL injuries are in sports, but they are preventable at a certain extent.